Well, we know the impact being overweight can have on our bodies and joints, but what about our mental well-being? Dr. Valerie Taylor joins us now from St. Joseph's Healthcare in Hamilton with more on her research, very interesting, into obesity, cardiovascular illness, and mental health. Thanks so much for joining us this afternoon. Now, this is kind of a two-way street, isn't it? Sometimes mental health problems can lead to weight gain, and other times it's the other way around.
Absolutely, and my work focuses on both, looking at individuals who have weight problems who then go on as a result of that to develop difficulties with psychiatric issues, and individuals who start off from an early age with psychiatric issues and then as a consequence of biological changes that seem to occur in the brain and the body with mental illness, and as a consequence of treatment of this mental illness, then go on to have problems with weight gain and with cardiovascular illness.
Because a lot of times it's the drugs associated with it, right, that lead to the weight gain.
Absolutely, and unfortunately it's a bit of a necessary evil. It's impossible for someone suffering from depression or from some other psychiatric illness to be able to effectively combat their weight while they're symptomatic with their psychiatric illness. But unfortunately, sometimes getting them well requires a medication that can cause weight gain, especially if it's not being monitored really properly by the prescribing physician.
Now, what's the best way to tackle this? What does your research show?
Well, I think it's not, something that's not unknown to all of us. Prevention is much easier than treatment, and so we need to work at understanding a little bit better some of the changes that occur that leads to both mental health in individuals with weight problems and vice versa, and try to do our best to prevent those things. It's very difficult once somebody is put on 40 pounds, as we all know, to get that weight off. And so I think that's the primary thing, is just education so that people are aware that these things are linked, and that if you have one, you have to do your best to try to minimize the impact on the other.
Right. Now, are there any mental health issues in particular that seem to be linked to weight gain?
Well, I think there's a number, and if we look at sort of from a developmental perspective, early on we know that exposure to trauma can be very difficult as someone gets older, and food develops into something that's very important as a coping strategy for some people.
It's a comfort thing to go to,
absolutely, right? It becomes something that is consistently there and can make them feel better. And then we know that attention deficit disorder, especially attention deficit in adults, is linked to problems with weight. Can you imagine how difficult it is to follow a diet if you have attention deficit disorder? And many adults don't realize that that's what's causing them to struggle to organize their schedules, to adhere to a diet, to pack a lunch. And then we have things like depression, and we know again the treatments of depression and of anxiety are linked to weight gain. And we also know that having these mental illnesses seems to deregulate just your body's hormone system in such a way that you're more likely to put on weight without having any kind of medication on board. And so across the gamut of sort of psychiatric diagnoses, there seems to be a vulnerability towards weight problems.
Very, very interesting work you've got there. Dr. Valerie Taylor, thanks so much for coming in and telling us about it today.
No, thank you for helping me highlight this important issue.
Very important.